Hi, I'm Dr. Kelly Starrett, a physical therapist and H-Wave Human Performance Advisory Board member. I wanted to spend a second talking about why we reach for H-Wave with our patients post-spinal surgery. Now, look, you all are experts in the complexity, potential complexity of patients who've been down a road of chronic pain and persistent pain, and then all of the associated sort of disuse that ends up happening from pain and fear guarding. So there's a couple things that are amazing about using H-Wave post-surgery. One is that obviously we are big fans of using the high frequency to help manage and sort of break through some of that pain that has been set up as a chronic persistent pain system. That's complicated, we understand, but so giving our patients pain relief so that we can get up and do rehab has been very, very powerful for us. Or we can begin to move again when patients' brains are still clearly in threat mode or still clearly in a state of not believing that they're actually appropriate to move. So getting a kind of clean slate and having a moment of being pain-free can make a big difference. The other thing that we find is that clearly post-surgery we have all of the normal sort of implications of surgical trauma and surgical insult. And the problem is that we have people who are trying to protect these tissues appropriately, and we can't get all of the non-fatiguing or just the muscle contraction to decongest the local area. So what we end up having is a very protected site that is difficult to decongest, difficult to compress, difficult to move appropriately or enough. So since we're barely just usually trying to get people back up to baselines of non-exercise activity of walking as our first intervention, one of the nice things about having H-Wave is that non-fatiguing muscle contraction means I can get thousands of contractions of regional muscles, regional soft tissues, and that ends up getting a lot of non-threatening input into the system, as well as continuing to decongest the system. So we're able to have a healthier system where we're getting the garbage out and bringing the groceries back in appropriately. We're also able to get, again, upwards of 20 plus hours a day of this non-fatiguing muscle contraction, which helps to rebuild those neuromuscular connections, and more importantly, again, helps us to help the patient have a lot of non-threatening input. The spine is undergoing a lot of local motion in the NMES device, and this allows our patients to begin to feel like they can reintegrate their brand new fixated spine or decompressed spine back into return to sport, return to life, return to function.